government announced €39 million extra to mental health services. And on the face of it, that sounds okay. But the reality is that only 14 million of this is new money, as 25 million was announced in last year's budget, and that was withheld. And you see this with a lot of these figures. As you have time to analyse a lot of the headline figures, you see that they don't reflect the reality in terms of the allocations at all. But while total mental health spend has increased in recent years, most of the money has been swallowed up in pre-existing services, just trying to meet the large increases in the demand. But mental health will only increase if we look at the budget from yesterday and how it affects rural communities in particular. You know, things even like, it might seem like small amounts of money, like the carbon tax measure and other things that increase the cost for people. The worry of the cost of heating a home and the lack of rural transport, which can lead people to even more isolation, it does affect people's mental health. It really does, in terms of isolation and people not being able to connect with their communities, not being able to get to hospital appointments and all of those things. So there needs to be obviously further investment into those things, but also in terms of mental health services. We see every day of the week where people with severe mental health problems are let out of acute hospitals. And we know what the outcome is for many of those people, and I'd say nearly everybody sitting in this chamber knows of people that has happened to. The revolving door system. Indeed, sometimes you can find with mental health patients when they present to A&E and they have to wait for hours upon hours and upon hours, they actually leave without ever getting assessed, and then others are assessed and maybe kept in for a day or two or kept in a trolley, and then they're let out again without any real care in the community, and in 6 months' time they're followed up with an appointment for a counsellor. And unfortunately, the fact is that in 6 months' time, many of them aren't with us anymore. That's the reality. And that's why mental health needed to be addressed in a very serious way.